So then I learned about, Bob Miller had me talk about the mast cell and the inflammation, and then in walks Eric Belkavagin is all his brilliance and teaches me another level about, okay, open this up. Like, how do you know if your patient's inflamed? How do you know? Do they come in? Do they have, like, what's going on? So he taught me, and I used those labs right there. I pull them out of my patient, and I'm looking for a pattern. I'm looking, because it's kind of hard, because people kind of throw around the word inflamed, and it's like, my knee's inflamed, or am I inflamed? But I really didn't I kind of took it for granted, or I didn't appreciate it when someone has, insulin level, that cell danger response, those things. That is inflammation. That will shut down your body's ability to get rid of toxins. That's not an ideal situation. I feel like that keeps people sick. They just cannot get over the hump. They can't get rid of their toxins. So I have that printed and laminated too. So what do we do as doctors? What do we do when these people walk in? Well, first we always, and Eric talked about this, Dr. Eric talked about the foundations. Nothing will trump nutrition, hydration, rest, and peace. Nothing. You don't get those right, you don't get to move on to the next level. So at every visit, we're talking about their nutrition. We're talking, and they're like, oh my gosh, do we have to go? Yes, we have to go through it. We have to go through your hydration, because bile is an aqueous solution. If you don't have a proper amount of water in your cells, in your body, your bile is not going to flow. And I'm going to do a big seminar this weekend where all I talk about for 2 hours is the downstream effects of bile, because I learned in medical school not much. Like bile, yep, good, fat soluble vitamins, that's about it. And then Eric blew my mind at one of the shy cons. It's just like thyroid metabolism, cholesterol metabolism, glucose metabolism, gut function, SIBO. It's just like, you got to get your bile right. You have to get your bile right. So then we identify the triggers. Okay, so what made that mast cell activated? It's probably a combination. And again, Dr. Eric, physical, chemical, emotional, microbial, taught me that. Look for physical things. So they have scars blocking meridians, or they need an adjustment. Do they need some laser work? Chemical. I mean, what are you washing your hair with? What do you put on your skin? Like, just do the inventory, clean that out for them. Do they have a chronic exposure to some chemical? You can use kinesiology to test for that. Is there something that they're just being exposed to that keeps on triggering the mast cell? And then microbial. Find out, is there something going on? Do they have a latent virus? Do they have something that's activated that you're just not catching? Because those are cumulative. We go after all of them. I'm always asking about all of them at once. We're doing lab tests to figure it out. We can do muscle testing to figure it out. And then the emotional. I poo-poo that, because medicine, we don't really talk about emotions and how, but I mean, you get upset, you can feel it in your gut. That there's that connection that's irrefutable. So doing things like heart math for the patient, keeping track of their HRV is a really important tool that I've used in the past couple of years. Doing Annie Hopper's dynamic neuroretraining for limbic stuff, going and seeing Carrie Wright, getting your spirituality settled. So really addressing that with your patients. I'm not the one who sits down, and I'm not a counselor, but I do have tools for them. I do address that, because that will keep them stuck. That will keep their 2.5, their phase 2.5 from not working. And then it'll piss off your mast cells, and you're just in this cycle. So I try and address all that with everybody. And then why not give them some things that calm the mast cell? They're looking at the literature, they're safe, they're effective. We're going to talk about PEA, which blew my mind when I started to look at these studies about what it can do in the randomized controlled trials that, again, take 17 years to get into the doctor's office, and maybe they never will because they're not profitable enough. So looking at that, and then having US Enzymes back that and bring it to you, I think that's awesome.